Western Uganda has been experiencing high levels of childhood malnutrition despite being known as the country's food basket. It is against this backdrop that the Ministry of Health and UNICEF, with support from UK Aid, started implementing a number of interventions geared at combating malnutrition among children under 5 in Western Uganda. One of the most pronounced interventions is teaching mothers how to feed their children with nutritious foods. This is done both at community level and health facilities. This is followed with empowering mothers to have vegetable gardens around their homes.
We teach mothers, when you're there at your place, you don't need a very big space to have these crops grown. So we show them on how you can use a small space to intercrop, to get various types of crops in the same area. So we teach them on how to start a nursery bed, on how you transplant them. And as you've seen, there is mulching. We do mulching so that the crops can grow well and they are well nourished, so that they can give us a good yield.
A mother of 2 from Ankole Sub-county in Kamwenge district, Agnes Musmenta, explains how mothers in this western part of Uganda have benefited from nutrition initiatives.
For our children would get diseases, but for us, we didn't know why are they getting diseases. So after teaching us, we got to know that the problem is that we are not feeding them how it is needed. We are not feeding them good food which can build their bodies. But after teaching us, we have discovered that food can also work as medicine.
This intervention is coupled with empowered village health teams to detect malnourished children have reduced the number of malnutrition cases requiring admission in health facilities.
We have trained health workers, the VHTs, through UNICEF. That's why I said UNICEF has done a very good job for us. We really appreciate the work they are doing for us.
I measure the centimeters from the shoulder to the elbow, and I bisect it into 2. Where it meets the halfway, I have to get that tape measure and carve it to the arm, and I pass the sort of a needle, the apex of a tape measure through the hole, and it comes to make or to measure the centimeters. So when the arrows shows in the red, that one I have to know that is a severe or red mark. When it goes in yellow, that is moderate. And when it goes in green, that I have to know that that child is normal. So from there, for the outcomes, I have either to encourage the mother to continue whether the baby is in green color. When he is in a yellow color, I have to assist him and tell her what to give the baby in order to upgrade her immunity, the baby's immunity to go in a green color. And when I found the baby is in a red color, I have to refer where she can get the assistance for her baby.
So at community level, we are now screening to make sure that before someone deteriorates, we have already captured. That is, we have family-led work, whereby mothers themselves at home are able to assess using a MOAC tape and know, oh, my child is not well. Then monthly at the community level, they come and they do weight taking to ensure that the growth is monitored. So before they deteriorates, the interventions are already given.
Like especially in trainings and community programs, we can see the cases have become few. We no longer have a lot of blood transfusions related to malnutrition. We no longer have a lot of abortions related to malnutrition. We no longer have serious admissions in the wards. Actually, I can say the admissions have reduced for very severe malnutrition cases in the wards. So that one has been actually a serious reduction, and I can say this is great improvement.
However, identified cases of severe malnutrition are managed at Mbarara Regional Referral Hospital, where therapeutic foods are administered.
Which is largely based on our granite, what we call OD, but we have added other minerals and vitamin mix to make what is suitable for a child who is now severely malnourished. Popularly known here as plum peanut, RUTF or Rutafa. Rutafa meaning that the child will not die, so you are preventing the child from dying. So we can use the plum peanut for the children who do not have other diseases, what we call medical complications. For example, if the child is severely wasted and also has severe malaria or has other complications, then we shall not treat that child using plum peanut or OD alone, but instead we shall use therapeutic milk. You heard people talk about F75, is formulation 75, which is a specially formulated milk of a certain energy level, and then F100. So these are used for children who have medical complications.
The 2024 report released by Uganda National Bureau of Statistics shows that 26% of children under 5 years are stunted, while 10% of newborns are of low birth weight. Adia Nakoche, UBC.